Andrea Flores. Denver's Mayor Michael Hancock is talking about the city's mask requirement and what should happen when the stay-at-home order is lifted Friday. Let's listen in.
Thank you. Our thoughts and prayers will remain with their loved ones. We've also had nearly 3,500 cases of COVID-19 in our community and 17,000 statewide. This virus is very much a part of our lives, and it will be with us for the foreseeable future. Because we have a lot of ground to cover here today, we're going to try to do something a little different. Following this press conference, we will be hosting a webinar with more information on everything we're going to talk about today. As you know, the state began a phased approach to lifting Colorado's stay-at-home order last week. In coordination with our neighboring communities, we determined we needed additional time. Because we are an urban center surrounded by dense communities, we have tried to move as a region, informed by public health experts in the metro region. We have underpinned our decisions on what the city's public health team, by the advice of the public health team here in the city of Denver. In the absence of a national strategy on testing, I wanted to use this additional time to work with local care providers and improve our testing capacity, including time to organize and train more contact tracers, tools that public health scientists say are critical to managing potential spikes in infection and support safer ways to open the economy. Here's what we're looking at right now. When it comes to testing, we now have the ability to do at least 1,000 swab tests a day, and we'll ramp up from there. We also did a canvass of hospitals and other clinics last week, and they told us that combined, they could do nearly 3,000 additional swab tests. In partnership with Denver Health, the Denver Police Department, and city employees, we are also on track to have at least 100 trained contact tracers. These efforts will give us a better lay of the land on the spread of the virus. We're going to do everything we can to help them ramp up the capacity on both sides, as well as ensure that residents in our underserved communities and vulnerable populations have increased access to tests. And I'm excited to say that we'll be launching a mobile testing process soon, and you'll hear more about that in just a few moments. More important, we have a consensus among the metro area's public health experts that we can now begin our phased approach to lifting Denver's stay-at-home order. With some additional measures I will describe to support physical distancing in our neighborhoods and workplaces. Denver residents have played a big part in getting our city to this point by staying at home, limiting their contact with other people, and wearing a face covering as much as possible. It's the people of Denver who have really leaned in to slow the spread of this virus. Based on our residents' efforts, the data we're seeing, and guidance from public health experts, we feel comfortable at this time not extending Denver's stay-at-home order beyond this Friday, May 8th, and starting the phased reopening of our city beginning on Saturday, May 9th. So here's what our residents can expect going forward. As you heard last week, a face covering requirement in certain public settings goes into effect tomorrow. A face covering doesn't have to be a surgical or N95 mask. It can be a bandana, a modified t-shirt, some of your ski gear, or clothing covering you can make at home. As long as it covers your nose and mouth, it'll work. This goes for anyone over the age of 3, except for people who have a medical condition that would prevent them from being able to wear a face covering. Residents and employees will be required to wear face coverings while inside of or waiting in line to enter certain businesses or locations, including any retail or commercial business,